So I haven't done a personal massive YouTube video for ages. Normally I just record music and gigs. Any people that follow my very, very small and limited and boring YouTube channel all know that I mainly record music venues and gigs. And sometimes I do mental health videos I haven't done for a long time, or day in the life videos as they are as well. I was fed up of doing all the 1 minute ones on Instagram today. So just a quick catch up to explain today and a bit of the time that I've generally seen the doctor. So I signed up to Goldington surgery in Bedford on the 29th of September in person 2017, after coming off the second NHS England run safe treatment scheme and being on it for a year from the 19th of September 2016 to the 19th of September 2017, and all I was waiting for was paper to release me and to do the best research online to make sure I didn't just jump into any GP surgery that was normal and local. And Goldington surgery, Goldington Avenue surgery in Bedford came up with the best patient reviews, best reviews and research in general. And when I heard they were taking patients, and I was officially off the scheme, I went there on the 29th of September, and luckily that was the last day they were taking patients. So on the 29th of September 2017 in person was the last day they were taking patients. So between the 29th of September 2017, I've only seen my personal GP 5 times. So I saw him on the 1st of November 2017 with a colleague. They assessed me. They said they were happy for me to be seen one-to-one. If I'm okay with them, they'll be okay with me, and so on and so forth. Then I saw him on the 15th of November 2017. Then the 24th of November 2017. Then I booked in for December 2017, just after Christmas. So probably the 27th, 29th of December 2017. Had to cancel that appointment, wasn't feeling well. Saw him again on the 12th of January 2018. And today is the 5th time I've seen him, which is the 14th of March 2018. And as he hasn't experienced the instability and the complex regional pain syndrome and the depression like my GPs in London would have done, I wanted him to at one point examine my wrist, not for an opinion, just so that if anyone like PIP, for example, personal independence payment, I found out on the 18th of January 2018 that although they did a pinch and grip test, they put in their report on the 7th of February that both hands, both wrists were normal function and normal movements. And anybody that understands mid-carpal instability, or at least does a basic examination of left versus right hand wrist, so up, down, left, right, full fist, and so on and so forth, they would understand that instability, well, in its name, means some form of instability. You don't quite understand it until you see it. And although not all of it's completely loose, most of it is, and it, without the wrist splint, the metal palmar plate splint, it strains and it aches, and it becomes unstable, and also it lies out of alignment. So I don't know what the normal angle or degree of the wrist is. I don't know what the degree angle is meant to be. Yet the left hand isn't at a normal angle, probably not even in the splint, but it's the most normalist it can be, and it takes the pressure off the instability. And so today I had booked the appointment, I think last week or the week before, and then I got a letter through the post saying, oh, we don't need to be experts. And I was like, no, that's not what I'm asking. I knew that my London GP, not only had they lived it, when I had the accident, I saw them one day after the accident, and they saw the swelling and the tenderness, and then they saw the distress as months and weeks went on and the swelling was still there. And no, I could hear things going on, I could feel things going on under the swelling, and I would put it up to my ear and I could hear the crunching and the grinding, and I could feel this, yet the swelling wasn't enabling it to be clear. And how we would go back and forth from A&E, and we kept asking to see an orthopaedic surgeon. And so one doctor's surgery in London lived it and examined the wrist more than once, and then my other GP surgery in London had examined my wrist more than once, and also left and right wrist and so on. Yet they lived the pain specialist letter reviews and the physiotherapist reviews and the more pain specialist reviews. And so today my GP had 2 medical students, which was really great. There was a big A4 sign on reception, waiting room, if you do not want, and this is your doctor, if you don't want to be seen by the medical students, just tell reception. I have no problem being seen by the medical students, because whatever profession they choose, whether they choose to be GPs, psychiatrists, psychologists, orthopaedic in general, hand and upper limb orthopedics, general surgery, pain management, anaesthetist, anything they decide to be, by allowing them to understand mid-carpal instability, by me taking my splint off, and splint has to be quite tight, because otherwise there's no actual relief from the strain. There's lots of strain and lots of pressure, and if the wrist splint is loose, then there's not much effect. And I know that the swelling isn't all from the splint either, because I've had to have it periods outside of the splint to confirm this, and then the worse the instability is outside of the splint, the less I use it as well. Also, although I said to my GP, yes, I do a lot of typing, and he says, yes, a lot, I do have a lot of emails that I never delete, and I have every letter where possible, apart from when the computer's really gone frozen and I've had to wipe the hard drive. I have copy and paste most of this stuff. I've learnt to type, if need be, with my right hand only. A lot of laptop or computer mouse copy and pasting. So it was good for the 2 medical students to examine the wrist. They didn't examine it completely. They were a bit surprised, but I just basically grabbed their hand and said, put your hand over my left wrist, and I will just move it as if I was doing the washing up, or I was holding a fork and applying pressure, or holding a knife and applying pressure. And the GP also was a bit surprised. So, I was like, well, when it comes to hand surgeons over the years, I've been examined, and when it comes to physiotherapists, I've been examined for 15, 20 minutes plus, and that's just on the left wrist, and that's then done on the right wrist to confirm. And I said I've noticed over the last couple of months that when I've been adjusting my splint, I now notice that moving the splint or moving my right arm, moving my left hand splint with my right arm, that my clunk actually moves now from further up in the arm. So the GP examined it much more in detail, asked me to clench a fist, and I just explained that although you won't get the 100% of the nuance, that yes, I can do a fist. There might not seem so much looseness on the thumb side. I can feel the instability and the clicks and the clunks and the grinding. I can feel it all. And there's lots of strain. And therefore a lot of pressure would make it even more strainy, and it can be strained under very little pressure, and I can feel it all. I know where it's loose, and so it was good for the GP to actually examine it, because I'm not going to be seeing a Bedford hand surgeon until like May 2018. I'm not sure exactly of the date and time. I think it's 2 p.m. That's why bloody 2 p.m. was in my head. It's the Bedford May appointment. Although they won't necessarily be able to tell me how much it's deteriorated compared to Homerton, if I'd gone to Homerton. Unfortunately, I couldn't go for the review. I couldn't get my questions. The new hand surgeon, will hopefully be able to give some advice. So 2 new medical students got to examine what an unstable wrist joint felt like with the clunking, and obviously little or no pressure, such as holding a fork out of the splint. And you got to remember, when you've been in the splint most of the day or most of the time, and you only take it off for physio or having a bath or shower, it remains stiff for a lot of the time. The longer it's out of the splint, you think the clunking looseness is loose. Well, say you were out of it for 2 or 3 hours, that clunking becomes even looser, because your wrist becomes less stiff. It becomes stiffer when it's in the splint and less stiff outside of the splint. I couldn't find the photos, but I was trying to find them. Unfortunately, they were operation photos or photos of me in a cast. But I explained that I've had loads of different angles of swelling, and I've had to compare it to my right hand and the rest of my body, and the swelling can change from different degrees day by day to no puffiness to you not even being able to see your knuckles puffiness, back to semi-flat puffiness, and the reason the splint is needed. And I explained that my old hand surgeon at Homerton spoke to Mr. David Lichman in 2008, and he explained that how the palmar plate splint helps with metacarpal instability, and especially around the scaphoid, pulling it back into semi-ish alignment in comparison when it's not in the splint, and how unfortunately the limited and full wrist fusion was taken off the table and stuff like that. And I know I've got complex regional pain syndrome, and I'm having problems with a new pain specialist who's sitting on the fence and ignoring my old pain surgeon and my old hand specialists. So it was good to teach 2 more medical students instability for whatever career they go in. My GP may have a better understanding at least. And then I just moved my right hand up, down, left, right, moved it. And he said, I don't need to see that. I said, yes, but I'm just comparing it to show you that my right hand is normal. And although Pip never examined my right hand either, yes, my right hand is normal function and normal movement. My left hand is not normal function and not normal movement. And anyone that understands instability or that can read NHS letters and advice letters, and although the consultants don't go into great detail, when I did between January 03 to July 2007 did have a personal injury case going on, my private medical legal expert hand surgeon went into more detail of exactly what both my hand surgeons, Mr. McCarthy and Miss Ang, were saying. So I'm going to post this up online. I did very short Instagram videos on my account, so I thought I'd do a detailed one. Alright then, hopefully I'll be able to upload it now.